Safeguarding, Assessing Need and Providing Help, Part 2. Introduction to the module. This module continues on the topic of safeguarding children and young people, focusing on the assessment process. You will learn how vulnerable groups are assessed and all the elements of a high-quality assessment. You will also learn about the referral process, outcomes for children and their families, and how you can provide support. Topics covered in this module are disabled children, carers, youth establishments and contextual safeguarding, assessment of disabled children and their carers, assessment of young carers, assessment of children in secure youth establishments, assessment purpose, protocols, principles and parameters, analysis, outcomes and timeliness of assessments. Disabled children, carers, youth establishments and contextual safeguarding. Disabled children. Disabled children refers to children and young people with a wide range of conditions and are more vulnerable. They may not identify themselves as being disabled. This includes children who are on the autistic spectrum, are deaf, have a learning disability, have a physical disability, such as cerebral palsy, have visual impairment, have a long-term illness, have a mental health illness, have a condition such as attention deficit hyperactivity disorder, ADHD. Children and young people with disabilities are at a high risk of being abused compared with other peers, Jones et al., 2012. They are also less likely to get the support and protection they need when they've been abused, Taylor et al., 2014. Professionals working with these children must identify their safeguarding needs and understand how to protect them, as they are often taken advantage of due to their increased vulnerability. NSPCC 2016. Assessment of disabled children and their carers. When assessing children with disabilities, the local authority also needs to decide whether they need to provide support, as stated in the Chronically Sick and Disabled Persons Act, CSDPA, of 1970. If so, they must provide the necessary assistance and services to meet the child's needs. The carer or parent of a disabled child may also have to undergo an assessment of their ability to care and provide for the child, as detailed in the Carers Recognition and Services Act 1995. If it is determined that the carer or parent may have support needs, an assessment must be conducted, as stated in the Children Act 1989. If carers or parents request an assessment, local authorities must also provide one. Assessment of young carers. If a local authority thinks that a young carer could have support needs, they must carry out an assessment, as detailed in the Children Act, 1989. They must consider the whole family's needs, according to the Young Carers Needs Assessment Regulations, 2015. The assessment of adults in the household can be combined with a young carer's assessment if both agree. If the young carer or parent of a young carer asks for an assessment, the local authority also needs to provide one. Then they need to decide, whilst taking into consideration the young carer's wants and needs, whether it will be suitable for them to provide care, or if it will be too demanding. Assessment of children in secure youth establishments. The specific needs of children who live in secure youth establishments should be considered during assessments. Local authorities are responsible for their safety and welfare. To guarantee one comprehensive support plan, each local authority needs to collaborate with the head of the secure youth establishment, the child's home local authority, the appropriate youth offending team, and if necessary, the Youth Custody Service. When a child moves into youth detention accommodation (YDA), the local authority has to visit them to assess their needs. Then a detention placement plan (DPP) can be created, listing how the YDA and practitioners can fulfill the child's needs. The DPP should be evaluated as any other care plan would be. Contextual safeguarding. Contextual safeguarding refers to keeping children safe in different contexts outside of the home, such as at school with peers, in neighborhoods, or online. Children may also be at risk of harm in these environments and can encounter multiple risks. Threats include online abuse, bullying, sexual exploitation and radicalization, extremist groups recruiting young people online, such as for terrorism, criminal gangs, such as county lines exploitation by drugs trafficking. Assessments of young people should look at the wider environment to decide whether their safety and/or welfare are at risk, including children who are involved in criminal activity, who children's social care services may or may not be aware of. Assessments in these cases should account for their vulnerabilities and needs, including parental capabilities in supporting children, to keep them safe and helping parents to be aware of the risks. Channel panels are held by local authorities, working with partners to assess the likelihood of an individual child being drawn into terrorism. If necessary, support will be provided to them. Local authorities in the UK have a responsibility to prevent people from being drawn into terrorism, Counter-Terrorism and Security Act, 2015. According to the Children Act, 1989, all children and their parents should be regarded as individuals, and that different family structures, religions, cultures, etc. need to be respected. Local authorities should make sure they support fundamental British values, mutual respect, acceptance of those with different faiths and beliefs, individual freedom, democracy and the law. Assessment purpose, protocols, principles, and parameters. Purpose of assessment. In any assessment, the purpose will always be to focus on the child's needs and analyze the level of risk. Determine if the child is being harmed or is likely to be. Collect relevant information about the child and their family. Provide support and safety if needed. Local protocols for assessment. Local authorities are responsible for local procedures for assessments. These should be decided on with their safeguarding partners and should state how cases will be handled once children are referred into local authority children's social care and be in line with existing legal policies. The details of all protocols. Every relevant organization and agency are required to understand these protocols. How these organizations and agencies will conduct communication with the child and family. The process for making complaints. When assessments will require special care for certain groups of children. These include young carers, children with special educational needs, children who have specific communication needs, children at risk of criminal gang activity, asylum seekers, children at risk of female genital mutilation (FGM), children who are in the youth justice system and those returning home, children in hospital, cases where there are risks for an unborn baby. If a child has other assessments, it is essential that these are coordinated to ensure consistency and that relevant information is shared. The principles and parameters of a good assessment. High-quality assessments should be child-centered. Decisions should focus on what is best for the child, depending on their age and development. Lead to actions that will help children the most. Ensure children's views are heard and provide appropriate support to enable this if the child has specific communication needs. Involve the child's family. Identify risks to safeguard children. Identify strengths as well as difficulties. Ensure equal opportunities. Be collaborative, involving the relevant organizations and agencies. Review support services provided on an ongoing basis. Be dynamic and holistic in approach. Adapt to changes and levels of need and/or risk to the child, both in and outside of their family. Identify the impact of what the child is going through. Information should be collected, recorded, checked, and discussed with the child and their parents or carers. Provide any support necessary to assist with the assessment process that the local authority agreed to. Record, monitor, and review the outcome of any services given to the child and family. Even if services are for the parent or carer, the focus of the assessment should be on the child's needs and the impact of services on the child. Support practitioners to identify whether a child has needs to do with their care or disability and/or is likely to be at high risk. Consider if an assessment is required of the support needs of the parent or carer of a disabled child. Prioritize the specific needs of children that are disabled and young carers during the assessment process. Be decisive on further actions to be taken to protect children from abuse and neglect. If concerns are stated, but care proceedings are not taken, then ongoing support should be provided to the child and their family. Provide a basis for follow-up work with the family if a child goes into care. A social worker must assess the child, and all identified needs should be dealt with before it is decided if it is safe for the child to return home. If they can go home, the proper support should be given to safeguard the child, even if the return home isn't planned. Social workers need the required skills and knowledge, as detailed in the knowledge and skills statements, for child and family social work. Time to complete assessments and have access to quality supervision. Support from principal social workers to improve their assessment and decision-making skills. The assessment framework. Research has proven that the most effective way to carry out a comprehensive assessment of children is to use a systematic approach, clearly defined steps in a logical order, with an evaluation of the outcomes shown through a conceptual model. For this purpose of a child safeguarding assessment, it is illustrated as a triangle, with each of the three sides representing a different factor of safeguarding. Please follow the diagram below. 1. The child's developmental needs, for example emotional, behavioral, and educational, including whether they are being harmed or are likely to suffer significant harm. 2. The parenting capacity, for example safety, primary care, emotional warmth, stability, the ability of the parents or carers to provide for the child's needs. 3. Family and environmental factors, for example family history and functioning, housing, employment. The impact of the whole family, as well as community and environmental circumstances. Focusing on the needs and views of the child. Every assessment should show the unique circumstances of the child, including their family and community environment. If children's social care services have accepted the child's referral, an assessment of their individual needs will be required. This will include the parent's ability to meet those needs. Often there is more than one child in the family that needs to be assessed. Family assessments should always still focus on the individual needs of each child. Each assessment, including those of a young carer, parent carer, or a non-parent carer, should analyze all the information collected from the child and family, as well as from practitioners, teachers, the police, etc. When a child has returned home from care, information from earlier assessments and case records should be considered too. Analysis, outcomes and timeliness. Developing a clear analysis. A social worker needs to analyze the information collected from all assessments to determine the type and level of the child's needs and the level of risk, if any. The relevant practitioners should critically look at the social worker's conclusions to challenge them. A decision can then be made on the best action to take and which services to provide to benefit the child's welfare and safety the most. A social worker may come to an early conclusion, but this should be re-evaluated as more information is available. Social workers and other practitioners need to make calculated decisions of what's in the child's best interest. This can be done by using gathered evidence, knowledge of child development, and findings from case reviews on the impact of abuse and neglect. Focusing on outcomes. A social worker needs to devise a plan of action with other practitioners and with the child and their family. The plan should state which services are needed for the child and parents or carers, who will provide them, why they are needed. The plan should give clear and measurable outcomes for children, state expectations for the parents, be reviewed regularly to analyze the progress made. This is important in cases of neglect, where parents or carers can make small changes, which will have a significant impact. Social workers should keep in mind common transition points, such as when children move from child to adult services. Timeliness. Timing is crucial for the outcomes for the child. A social worker will decide the speed at which the assessment will be carried out, depending on the urgency of the case, based on the child's situation and level of risk. The initial assessment should be completed within 7 working days. When the specific needs of the child have been identified, social workers should immediately contact the relevant services to provide the support needed, and shouldn't wait until the end of the assessment. In more urgent cases, the child's needs will require an assessment to be executed quickly. When a child urgently needs protection, the social worker, the police, or the NSPCC must take action immediately. The social worker should keep 2 planned review points so that they can keep track of progress made during the assessment process and after, in a timely manner. When a referral has been made, the social worker should respond and decide about the next steps within 1 working day. This will depend upon if the child needs immediate protection, if the child needs to be assessed, if there is evidence the child is suffering or is likely to suffer significant harm, if the child requires any services and what type, if additional specialist assessments are needed to assist the local authority with their decision. It should take no longer than 45 working days from the initial referral to the decision being made on the next steps of action. If an assessment process takes longer than 45 working days, the social worker needs to state the reasons for going over the time limit. It is the responsibility of the social worker to communicate clearly with children and families about when and how the assessment will be done, and when they should expect to receive a decision on the next steps. Summary. In this module, you have learned that disabled children are particularly vulnerable and must be safeguarded. When a referral is made, the social worker should decide upon the next steps within one working day. Assessments should be prioritized, depending on the level of urgency. There are many elements to a high-quality assessment. Assessments should focus on the needs and views of the child. Timing is crucial in the whole process of safeguarding, from referrals to assessments, to the outcomes for the child. If a child needs urgent protection, the social worker, police, or organizations such as the NSPCC should take action immediately.